Okay, now, yeah. Yeah. Yeah, okay. So as I said, you have four tests and you have to go to do these tests. They will be online, so that is the advantage of the hybrid format. And then, so for the test, well, this is about the medical theme. For the test, you will get the questions that will be uploaded in Ilias, and then you have a certain time to answer the questions, so you just have to download these questions. I think it's in Word format. Then you answer them, and then you have to upload these questions again, and you have a certain time to do this. Yep. And this is more or less the plan for the exercises, and here you have also the days where the tests are taking place. So you also have this slides on Ilias, so you don't have to write it down now, but you will find it also there. Yeah. And well, about the exercise topics, there are four main topics. So the first one is about blood pressure, and blood pressure is something very important to control, as you know, because it's one of the main risks of cardiovascular illness. And if this blood pressure is not regulated, many people could die. So there are many cases of hypertension, and that's why we have to control this blood pressure and know how this works. Apart from that, we have the topic about the prosthesis. So for example, as you know, if someone lost a leg or something like this, then you have to place a prosthesis, for example, in the knee or just in the arm. And usually you have just to place electrodes in the different nerves so that you can control actually this prosthesis, so that the communication between the neuronal system and also your body is somehow intercorrelated. Apart from that, we have the hearing devices. So I don't know if you heard about it, but in the Uniclinicum, they did also this kind of cochlear implant. And then babies, very small babies that cannot hear at all, just by doing this kind of implant, then they can hear and they can communicate with other people. So this is a very good advantage and a very high improvement of the science. And we will talk about it also on the exercises. The last part is the peripheral nerve interfaces. So for example, you can just mix this with the joint prosthesis, because for example with the time electrodes, then you can send different signals to the nerve system, and then you can actually do that this robotic arm is moving. And for this, we need the electrodes. Okay, yeah, there are five topics. So, and the last one is for the stents. So if you have there is your heart, you have the arteries, and then for many cases you may have a thrombosis, or there is a narrowing of these arteries. So this could produce clotting in the blood, and this may produce at the end a brain stroke or something else. So for this, the solution is to do a surgery, and in the surgery you just apply the stent into the artery with a balloon. This stent just gets bigger, and then the artery thickness or the diameter then it also gets bigger. So you are preventing this clotting or this infarct that may happen to many people. So up to now, this is the introduction about the exercises. Do you have any questions about the test or about the topics? Or okay, doesn't look like that. So first, I'm going to explain about the blood pressure monitoring system. And well, I'm explaining this part and not Ali, because I'm working with blood pressure. I'm using something else, not the things that we are talking about here. So I'm using ultrasound to measure blood pressure. But well, it's somehow correlated, and I also need to know all the principles. And the main thing that you have to know is how this blood pressure is produced. So as you know, we have the heart. The heart is like the pump of our body, of all the blood that is delivered through the whole body. And you have 4 chambers. So these 4 chambers make that the blood gets oxygenated, go to the whole body, comes back again through the veins, and then it's the oxygenated, and then again it has to go to the lungs to get the oxygen again. And that is more or less what you also see here on the right. So if we just, it's a closed cycle, so you can begin with any part of the heart, but for example, we can just begin, let's say if we just go here to the blue lines is the blood that is the oxygenated, so without oxygen. These blue lines, so they are like pipes, and they are referred to the veins. So we have the vessels, and in the vessels there are the veins and the arteries. The vein with the oxygenated blood, and the arteries with the oxygen. So if we just go here, and then we go to the right atrium, so if we just look into this picture, then we will see that the right atrium is here. So this blood is coming from the superior cava and the inferior cava. So just from the upper side of our body and the down side of our body. Then we have a valve. So just when this is completely full of blood, this valve opens, the whole blood goes to the right ventricle, so just as we see here, and then when this is again full of blood, this valve opens and it goes to the pulmonary arteries. So then we go to the lungs. From the lungs, all the blood gets oxygen, and then it comes back to the left atrium. So just, I think the left one is here. It just comes from the lungs artery. Goes to the left ventricle, and then it goes to the aorta. And the aorta is the biggest artery that we have in our body, so the one with the highest thickness, and is the most important one because the aorta is the artery that is in charge of delivering the blood to the whole body. So as you see, you have the different conducts here. For example, we have the carotid artery, so we have the right and the left, and this is one of these that you see there. So for example, here. And usually, so when we measure the blood pressure, the value that we want to get is the central blood pressure. And the central one is the one that we measure in the aorta. As you know, we use this cuff that we just place it here, so we are not measuring actually in the aorta artery, but we are measuring in another one. Does someone know where we usually measure the blood pressure? Which is the name of the artery? Yeah. No.
I don't know the name, please.
Yeah, so there are many places, but as you know, for example, you have this, I think I brought it also. Well, here, so the typical cuff that you use to measure blood pressure, and as you know, you always place it here, right? So we place it here because we have an important artery here to measure the blood pressure. Does someone knows the name? So it's the brachial artery. And we always just open it. I think you know. This one, usually you have this sign, so with the arrow, where you have to place actually the sensor, and then you just cover it around your artery, and with this you measure the blood pressure. So this is the typical thing that you can buy at home, and that many people have at home, and then you can measure the blood pressure. And it's the brachial artery. Well, now I'm not doing it very well, but yeah. You just place it inside, and then it's here, this artery. Okay? And yeah, as he said, we can measure also the blood pressure in other different arteries. So we have the carotids, right? That is here. So usually you can also measure your pulse. For example, you just place the fingers, and you can notice it also. And if we are doing, for example, some invasive measurements, we can also use the radialis, so the one that we have here. And this is what we use actually with the palpatile method. So these are the different arteries, so the brachialis, so this is Latin, but well, is the one that you have here. Then you have the carotids. I don't think you need to know this name for the exam, but well, I think it's interesting. And then the radial artery. Okay, this is in the hand. This is on the hands, on the throat, and this is on the arm here. Yeah, but this is well about blood pressure. We're coming back again to the heart. Then you know that usually in the heart you can measure, for example, the ECG. So these ECGs are these electrical signals that just show you how the whole electrical movement of the heart. And well, I think Professor Stiglitz will go more into detail about this QRS complex just in the lesson about the pacemaker. And when doctors look usually at the ECG, for example, when someone has an infarct or a brain stroke, and actually you see that the signal looks completely different. So, yeah. So about the blood pressure, so blood pressure, what we actually measure is that we have arteries in our bodies, and we can think that they are similar to a pipeline, for example. And then we have a certain thickness, so it's just like this. We look into an artery. We have here the blood in the middle with the erythrocytes, for example, of the blood cells. And then the heart is pumping, and this blood is going to the whole body. So we have actually a thickness. But when the heart is pumping, then the arteries, as we know, they are elastic. So they just move. So these are the pulsations, and they are elastic, they just distend, and then you will see something like this. More or less. And then when they are more extended, then you can say, okay, this is the blood pressure in the diastolic and the systolic, sorry. And when they are in the relaxation position, then it's the diastolic. So systolic is usually the maximum value, and diastolic is the lowest value. So what happens is that you have the heart, and you have these muscles of the heart that compress. And when they compress, then the blood from the aorta just goes out to the whole body, and that is exactly the point where we have the systolic blood pressure. So the maximum one. And usually we have this artery, but there is kind of a reflow that is coming back, and that's why we have here the necrotic notch. Then this blood pressure is going to be reduced because it's going to be sent to the whole body, and then we have the diastolic blood pressure. So this is just the relaxation of the heart. So we have the compression, the blood goes through the whole body, then the heart relaxes, and then we have the minimum value. So the diastolic one. If we just measure the pressure, then we will also see that we can actually measure the pulse, because this happens every second. So the same curve, we will see it also every second. Yeah. And so this is more or less what I said. We have systolic, maximum value, diastolic, minimum value. So usually the normal ones, although here we see different values because it depends on the person, it depends on his women, men, so the age, and so on. There are many factors. But the normal blood pressure is always 120/80 millimeters mercury. Okay, this is a normal blood pressure. And if the values are lower than this, then we have hypotension. If they are higher, then we have hypertension. Yeah, here you can see, well, here there are in the slides, the unit that is also used is the torr, where usually we use millimeter mercuries, instead of, you know that in the international system is Pascal. Does someone know why we use millimeter mercury instead of Pascal? So this comes from the method that they used to measure at the beginning. So you have this kind of pipes, and they were filled also with mercury, because can I paint also on the other side? Yeah. So I think it was something like this. Well, you have kind of a pipe, and a part is full with mercury. So for example, this one. And then you just get the values from the other part, from the person, and then you get another height of the volume. And then just calculating the difference between the mercury that you have, the height of the mercury and the height of the blood, for example, then you could calculate the blood pressure. But this is, yeah, it's just because there was kind of a pipe like this, and it was full of mercury. So that's why we actually use millimeter mercury. Yeah. I know water painting, but I try to explain as much as I can. Yeah. Well, it's always bad if you have low blood pressure, or if you have high blood pressure. And that's why it's also very important to control these values, and that's why people sometimes they do it at home and they try to control it. Apart from that, when people get older, they usually have higher values of blood pressure because the arteries they got more rigid, so they lose this sensibility that we have when we are young. And then because of this, the values that are expected for all the people of blood pressure is higher, just because they are not so elastic anymore. Apart from that, if we have, for example, if the arteries, they are just narrowed or something like this, then the pressure will be bigger. As you may expect, if we have hypertension, it means that there is a lot of pressure going through the arteries, and then this may produce that the arteries they just break, and this produces also a stroke of the brain, and this is very problematic. So that's why in many cases it's very important to control the blood pressure very often. Yeah. So hypertension is just when we have these very high values. And also the heart, it has to pump faster, it has to work much more harder, so what is not good for our body. We have then the risk that the strokes may be produced. There is, for example, a myocardial infarction, or yes, the aorta gets swelled. We have peripheral arterial disease, so there are many different things that may happen after the blood pressure. So, for example, blood pressure is also related to the kidneys, so that's why we may have some diseases. Blood pressure is very important because it looks, I think it's even more than that, but there are more than 14 million of people in Europe that are diagnosed with hypertension. And the typical solution is that the doctor gives you just medicine for that, but in some cases the medicine is not enough. So that's why the doctors or the researchers, they have to look for other solutions. Usually it's called like silent killer because it's killing you like silently. It can give you, also it tells you how your cardiovascular system is performing, and it's the most important one actually. about the blood pressure monitoring, so now I'm going more into detail about how this system is working. So we have different methods, the non-invasive and the invasive, and as you may expect, the invasive is also more accurate, the non-invasive not so much, but for that we don't have any problems of infection, so we don't have to introduce, for example, a catheter in unsere arteries, or we don't have to just do a surgery and introduce this invasive blood pressure sensor inside of arteries. So it's much easier to do. For the non-invasive methods, we have the palpation method. So palpation is clear why, because we just place the fingers here. So we have the cuff. I think then I have to maybe do the next slide. No, this is the historic. But well, in the palpation, it's just because you place the fingers here, so you just place the cuff. So you don't use the stethoscope, auscultatory, because you also place the stethoscope. So that's why it's called auscultatory. And the oscillometric method is so just the typical one. So this is oscillometric. You just place the cuff, press the button, and then the cuff is inflating. Then it just de-inflates, and then you have the two values. So this is the oscillometric method. Apart from that, we have the invasive, so intravascular cannula is the typical one with the catheter, and you can introduce it in the brachial artery, for example, in the radial or in the femoral artery in the leg. And then the implantable pressure sensor. So about the historical view, so blood pressure measurement is relatively old, so it was done already long time ago. The first time was with a horse, so not very nice for the animal, but well, at least I hope now we are better and we just don't use an animal directly when we want to check something. And then as you see, there is kind of a pipe that we just place inside this animal, and then when this blood was just going high, then they just measured this height, so it was 2.5 meters, and then they just stress the horse, and by stressing the horse, then you get higher values of blood pressure, and they just try to correlate and see how the difference were. So just when the horse is completely relaxed and when this horse is also stressed. Yeah. So well, to have high values of blood pressure, you could also use coffee, but yeah, this is another. So the typical methods to measure blood pressure, the non-invasive one is the river rocking, nanometer. So this is, inside this one there are two ones, so the palpation one and the auscultatory one. In the palpation, it's just you place just a cup, like this one. So like this, you have the cup and you have something that you are pumping. And here you see the values of the blood pressure. So you just place it into your arm, and then you are just pressuring this gauge, I don't know how to say this. This is called like this. So like this, you are just pressuring it, and then you are occluding the artery. So usually you have to go to higher values than the systolic blood values, so more than 120, so you can go to 130, 140, and you will see these values here. And one that you are going to these very high values, the artery is completely occluded. So by doing this occlusion, then you change the flow from the laminar to the turbulent. And due to this turbulent flow, then you will see some oscillations. So these are the oscillations that you see there. I don't know if I have, maybe with the mouse, no. There is no any pointer here, right? Okay. So maybe with the mouse I can, no. Well, here you just see, on the graph, you just see a line, so a straight line with values that go above 110. So this is just what you are producing here. Then you just release this. Just exactly at the moment where you, at the beginning, you won't feel any pressure because the artery is completely occluded by placing the fingers, and then you begin to feel the pulsations of the artery. And at this moment, this is the systolic blood pressure. So then you release this, and that is. So you just can measure the systolic blood pressure by using the palpation move, and it's done in the radialis. So just for emergencies, so for example, if there was an accident and then there is someone on the street and they are waiting till the ambulance comes, so usually this is the most fast method to see if the pressure is fine. And the other method is auscultatory, and for this we also just hear the pressure with the stethoscope. So this is so something like what all the doctors use when you go there. So it's this one, and then you hear while you are applying the cuff. So this is a stethoscope, and you use this in combination with this when doing the auscultatory method. So the principle is the same, but you are at the same, in parallel, you are listening to the pulsations of the artery. So you just inflate the cuff at 240 millimeters mercury, and you are also listening because we have these turbulences in the artery. So just when the systolic blood pressure is happening, then you will begin to hear a noise. And these are the sound levels that you just see on the top. So then we begin to hear a noise, and then we release the pressure. After releasing the pressure, we will still continue hearing these noises, and then suddenly not anymore. So that is exactly the point where the diastolic pressure is happening. They are called, well, the sounds that you already hear is the Korotkov sounds. That is more or less how these two methods are usually used. And actually this method, the auscultatory method, is like the gold standard to measure blood pressure. So this is the one that is mostly used in hospitals, and it's like the most reliable one till now. Okay, it's more or less clear how this works, so should I repeat some part of it? Okay. Yeah, and the third one is just the oscillometry, so it's actually this one. This is the only difference is that well, we just click into the button, and then it begins to occlude the artery, then it's occluded, and then it's released again. So from the time that we just release the pressure, then we are going to measure a curve like this. And these are the oscillations that are produced inside the artery, so because of this turbulent flow. These are the oscillations, and what we do, they are exactly the same oscillations that we heard from the other method, from Korotkov. And what we do then is just to use an amplifier inside this device. Then we amplify these oscillations, and then we measure the maximum one. This maximum one will be AM. Then it is just demonstrated that the systolic pressure will be by 0.5 of this AM, and the diastolic is 0.8 of this AM. So just the maximum pressure. And then these values will be just converted, so from analog values to digital values, and then you can see it in an LCD screen. Apart from that, usually as you already know, we usually take the diastolic and the systolic blood pressure values as the reference ones, but we can also take the medium arterial pressure. So this is actually also another important magnitude, and this is calculated in this way. So we have the diastolic blood pressure plus 1/3 of the difference between the systolic and the diastolic. So for example, for the normal blood pressure, it will be 120 millimeters mercury plus 1/3 of 40 millimeters mercury. Yeah. Okay. And these are the non-invasive methods, so there are much more apart from that, but well, they are the most important ones that you have to learn. And we have also the invasive methods, so this is just by using a catheter. Usually it's used in invasive, in the CPU, so in the intensive care units. And then you just place this catheter into the artery inside. You should be very careful placing the height of the catheter, so if the height of the catheter is not at the height of the brachial artery, for example, then you get wrong values. And then after that, you have also a transducer that just change these values of blood pressure into the digital ones, and then you will see these values into the monitor. The main important part is that maybe there is some risk of infections because well, you are placing something into the artery, so this can get infected. So this is the typical most high problem, but well, usually nothing should happen. And it's used in intensive care units. Apart from that, we have the implantable blood pressure monitoring. So I don't know if you know, for example, the company of Neuroloop. So this is actually what they are trying to do. They develop electrodes, and then they place these electrodes in the vagus nerve. So this is more to control the blood pressure, so not just to measure. You can diagnose the blood pressure, but you can also apply a therapy and try to control this blood pressure. So for this, you can just use implants, place them, for example, in the vagus nerve, and then you can also see this blood pressure in real time. For this, you can use a wireless connection, so just send the data, for example, to your mobile through this wireless connection. And as you know, it's very important that it's biocompatible because it's inserted inside the body, and it should be very, very small so that it doesn't produce any problem. Yeah, so this is actually very important, and it's just permanent, included into your body. You can do continuous measurements. So with all the other devices, you just do discrete measurements because you apply this kind of cups, you measure one time, but you have to wait, and you cannot. You have to wait and measure later on again. For example, for people who have to control the blood pressure like 44 hours for every day, while you are sleeping, you can imagine that this is not very comfortable. So that's why in some cases these implants are used, because they are quite comfortable for the user and you get continuous values of the blood pressure. So you can have a better follow of how your cardiovascular system is working. Yeah, the main important thing is very interesting that they are wireless, so this is very good for telemonitoring, for example, from home, or telemetric measurements. Yeah, apart from that, you can also measure always the pulse rate, because each peak of the blood pressure curve corresponds actually to the pulse rate that you have. And how does it work? So we have just a capacitive pressure sensor. So we have a membrane, and there are two electrodes, or two electrodes, one on the top, one on the bottom. In the middle we have air, and because we have air, then we have a permeativity, and therefore we can just determine the capacity of this membrane. So just when we have a higher pressure, then this membrane just contracts. So this means that the space between the two electrodes is smaller. So then therefore this capacitance is going to change. So this is this typical equation. Maybe here. Yeah, so the capacitance, as you already know, this is the one of the air, this is the relative permittivity, and then you just multiply by the area of these electrodes that you have, and you divide it by the distance between them. This means that when the distance is smaller, the capacitance will be bigger, and then you have like kind of a variable capacitance inside your arteries. Yeah, they have a low temperature drift because you know in the body we have different temperatures, so it's very important that we have a very good drift with these sensors, and always we need the whole circuits inside, so just next to this implant. So usually we use CMOS to do the whole circuitry, like the amplifiers, filters, and so on. And this will be done everything, so now very compact in one single chip. This is an example of an implant. So this is, well, relative old. There are new ones, for example, that they just use a balloon or this stent to put it into the artery, and they are actually very, very compact. But this is something that was done in Germany, and as you see, the diameter is of 2.6 millimeters. So for example, if you think about the carotid artery, the diameter is of 6 millimeters. So it's always important that the diameter of this implant is smaller. Then we have also an antenna to send the signal outside through the wireless communication and also inside. Then we have these three self-expanding levers, so these three ones, because at the beginning they are just close together, and then once that they are introduced in the artery, they just open and they just place in the right position of the artery. Silicone is just for the package to be protected, and also Parylene C-coat is for the better hemocompatibility. This is just a circuit that you use, for example, for the temperature drift. So you have a capacitor that we saw, this is changing with the time, and then with this value is changing, so we have also another one that changes related to this. For example, this capacitor may also be affected by the temperature, so that's why this reference capacitor is going to change also according to this. And this is just to avoid that the temperature drift produce wrong values in the blood pressure. Yeah, and this is like the CMOS chips looks like. So we have just antenna here. No, the antenna pads are there, and here is the whole electronic. Here on the top, I think they are just the contacts for the voltage, because we have to apply 3 volts so that the circuit is working, and we just apply the contact on the top for the DC. And the power consumption, as you see, is very small, because you actually have a very high power consumption. So if you think of watts, then you need a very high battery, and you cannot place a very high battery inside the body. And these are dimensions. Well, this is just so everything in one single chip and just integrated with the implant. And this is just the placement of the implant. So here you just see that you have a catheter, so everything is closed. These are the expanded levers that they will just open later on when they are around the right position. And then at the end, just this catheter, the guiding catheter, will be removed. And then again, it just placed at this position. And then with this, we can measure the blood pressure wireless and continuously. Yeah. Always for the blood pressure, so if we want to measure continuously, we have to calibrate it because each person has different values of blood pressure. So as any electrical device, you have to calibrate it before, and then you begin to do the measurements. And when you do this out of the body, and maybe also one measure inside the body, and then you begin to do these measurements. And this is just one picture of where do they place this. So this is just in the around the femoral artery. And here, as you see also, if you just take into account the peak of the blood pressure, then you see that they always happen every second. So you can actually have the pulse of the person who is carrying this portable, this implant. Then, apart from that, you can do measurements in parallel. So you can measure also the ECG, as you see here. So just by placing, I think here is more clear. So just by placing some electrodes here on the arm, you miss the ECG. And then with optical sensors, you can miss the PPG. So this is the typical sensor that you just place in the fingers. So this is optical. And then you get recordings of your of the curve, so kind of related to the blood pressure. So the curve is similar, but then you have to do some calculations to get the blood pressure out of it. The advantage of using these two curves is that usually you don't need to use the calibration, because the only method that there is just the cuff to do the calibration, and by using like multimodal sensors or other measurements, then you can just remove the cuff and do everything like very comfortable for the patients and with very high accuracy. Yeah, apart from that, here is just when you use two commercial ones, so for the ECG and for the PPG, and then you can see, yeah, just different values like the pulse, transient time, and with this you can calculate the pulse wave velocity and other arterial parameters. There are also these flexible patches, so you just place, for example, a patch here, so it just like paste onto your skin, and then with this you can measure blood pressure. So this is something like very, very nice and very cool, and you just place it there and you measure it. And well, this is I don't know if these photos are from Neuroloop, but it's something similar to what they are doing. So we have, this is the vagus nerve, it's just here. And with this is just connected to the neuronal system. So usually we have the baroreceptors, and for example, when our values of blood pressure are very high, what the baroreceptors do, or our nervous system, is just to control these values and to reduce them. So they send a signal back so that the arterial blood pressure is always constant. And this is done through this nerve there. And there is the possibility, for example, of placing like cuff electrodes, so they are just around, so this is the artery, they are just around it, and they just control these values so that the blood pressure is always regulated, and there are not any problem with hypertension or hypotension. And this is actually approved for sale in Europe. Okay, so this is for today. I guess next week you will have the second exercise with Ali about knee joint prosthesis. Is there any question or something that you didn't understand? Or? Yep. One first, and then because you have to be at the same time, and yeah, I got to you.
When we put a device for measuring blood pressure in the artery, can it increase the risk of thrombosis or whatever? Because
yeah, that is other of the risk of placing. So he just asked if by just wait 1 moment. So just by placing this, you can also increase the risk of thrombosis, infections, and so on. Yeah, that is right.
okay.
That was your question, right?
Yeah, but I mean, like, if we put it, like, for example, guard artery, I mean, isn't it like more dangerous because like if the carotid artery is blocked, I guess it's lethal. And like if like we will have like a thrombus, for example, somewhere in the arm, it's like it's less dangerous.
Yeah, so that's why usually the most common place where they place this catheter, so you look into the videos and so on, is always this artery here.
Okay.
Either in the radial or this one. Or also the femoral one. But in the carotid, usually it's on the central blood pressure is mostly not measured at all. So that's why you don't measure in the aorta yet. So just the peripheral one. And then you can use equations to extract the central blood pressure, but yeah. Usually it's the brachial or the radial. Yeah. Yeah.
I think it correlates with this question. Is there also a possibility to measure around the arteria? Like, because now you go into the arteria and measure the blood pressure, but there is like a list of blood cells like coming together and like twisting a stroke.
So you mean like invasive and invasive? So just by using the cuff electrode, for example.
But I mean it's an electrode, or because it needs a capacitive element then to be around the blood. It's not about measuring on a nerve, but measuring with a cup capacitor around the.
I think it's also possible. Yeah, I saw something. There was a paper. I think they used something around the artery. But I don't know if it was capacitive or they used something else, but I guess you can also do it. I think I also saw it. Maybe if I find it, I can upload it in India. But there was a paper also, yes, kind of something around the artery, because yes, then it's less invasive. You don't damage the artery, so yeah. I think there is something done in this way. Yes. Okay. Any other questions? Yeah. Thank you very much. The questions were really interesting, and yeah, I hope you enjoy the next exercises and have a very nice day.